This is a 17-year-old female presenting today for a routine wellness exam. She denies having any acute complaints or concerns at this time. She reports overall good health, balanced nutrition, adequate sleep, and regular physical activity. Okay. Hi, Gracia. Hello. Hi, my name is Bianca. I'm going to be the nurse practitioner to see you here today. Thank you for coming into our pediatric clinic. So I do just want to start you off for your wellness exam. We'll ask you a few questions. We'll review your vital signs, your vaccines, and I'll do your physical examination. And then after, we'll go over everything at the end, okay? So for today, we do want to start off just making sure that you are healthy. Do you have any past medical history that you're aware of? Anything you've been diagnosed with before? Or anything that you are taking medications for?
No, I'm not currently taking any medications.
Okay.
I haven't been diagnosed with anything.
Okay. And any allergies to any medications that you're aware of or any foods?
No,
Okay, perfect. And then any past medical histories such as, your mom or dad or grandparents having like diabetes or high blood pressure or cancer that you're aware of?
No, nothing.
Okay, perfect. And then we are going to ask you a few questions that include some private questions, okay?
Okay, no problem.
Okay, so who do you live with right now?
Right now I live with my parents and I do have a brother as well.
Okay, nice. Do you feel safe at home?
Yes.
Okay, perfect. And then you are currently in school?
Yes.
What grade are you?
I'm a junior going into senior year.
Oh, nice. Okay. Looking forward to college?
Yes. I'll be applying.
Oh, nice. Do you have an idea where you're going?
I have a computer skills.
Okay, cool. And then you're doing okay in school?
Yes. I'm doing well.
Great. And do you feel safe at school?
Yes, I do.
Okay, nice. And then right now, what type of activities do you do?
Mainly running track.
Oh, nice. Okay, cool. Are you looking forward to the new season next year?
Yes.
Your last one, huh?
Yes.
Oh, that's awesome. Okay. And then right now, do you use any drugs or do you smoke any tobacco products, including chewing, any vaping that have nicotine or anything like that?
No, no smoking, no drinking, no drugs at all.
Okay, perfect. And then, are you sexually active?
No.
Okay. And we do have to ask this to everyone around your age group. Is there any thoughts of hurting yourself, or have there ever been any thoughts of hurting yourself?
No.
Okay. Do you ever struggle with like anxiety, depression, not being able to do things you enjoy?
No, nothing.
Okay, great. And then overall safety, you use a seatbelt when you are
Yes.
in the car. Do you drive yet?
No, not yet.
Okay. So you don't have to worry about if you speed.
Okay.
Okay. So great. And then overall, nutrition wise, do you feel like you eat a good amount of fruits and veggies
Yeah.
every day?
Yeah, I eat a good daily serving amount of veggies, fruits, enough protein,
Oh,
and
perfect.
grains too, since I'm
Okay,
not.
perfect. Okay. And then also, how much do you sleep every night?
I'd say 8 to 9 hours.
Oh, great. Okay, perfect. Okay. So, all right, we'll start your physical exam. I do just want to review your vital signs with you.
Okay.
We do have them here. Your blood pressures was really good, 108 over 68.
Okay.
Your heart rate was 72. Respiration rate was normal at 16. Your temperature 98.4 orally. Your oxygen saturation is great, 99% in the air. Your height is 5'1".
Yes.
Sounds about right. And your weight, you weigh 115 pounds, so that makes your BMI at 21.7, which is a normal range. Okay. All right. So I'm going to start your physical exam. So overall, great, well appearance. You do not appear ill. You look hydrated. You look well nourished, well developed. I'm going to take a look at your head. I just want to make sure everything's okay. We'll just palpate your scalp here. Everything feels great. The head looks normal cephalic. And now we're going to take a look at your eyes. Okay, I'm going to shine a bright light. Just look straight ahead. Your pupils are round, equal, and reactive to light and accommodation. No vision changes that you have noticed. No, perfect. And then your ears, I'm going to take a look inside, or actually, I'm sorry, let's have you follow this light. Okay, so I'm just going to have you follow it this way. Okay. Very good. Okay, perfect. So we are checking cranial nerves as well. And that is intact. Your ears, any hearing changes that you've noticed. Okay. We're going to take a look inside, okay? We use an otoscope for this. So we look inside. Okay, you can see the tympanic membrane is shiny. It's pearly. Let's check your other ear with the otoscope. Great. They both look normal and intact. The tympanic membranes are pearly gray. There's no erythema and no bulging. You're gonna look inside of your nose. You're gonna make sure it's good. Your septum is not deviated. It's right in the middle of how it's supposed to. Both of your nerves are also patent, which means that they're open. And there's nasal mucosa that's pink without drainage. We're gonna take a look inside your mouth. Okay, so there's a healthy looking teeth, a good dentation. You'll have you say the tonsils are not swollen, uvula is midline, and then I'm gonna have you stick out your tongue. Okay, can you puff up your cheeks? Very good. I'm gonna have you open up your jaw, move it side to side. Perfect. Okay. No pain when you do any of that. And I'm gonna also just palpate on your head. Okay, so I'm gonna check here. No tenderness? No. Just let me know if there's tenderness. Perfect. I'm gonna check your lymph nodes. Check your lymph nodes here. All right, no lymphadenopathy. Very good. And your neck is supple. We're also gonna take a look here and check your thyroid. I'm gonna have you swallow. Perfect. Just take a look. Okay. There's no swelling, so no issues with thyroid or goiter. Okay. Now I'm gonna listen to your lungs. Okay. Okay. So I'm gonna listen to your lungs and listen in the front and in the back. Okay. You have you take deep breaths every time I move my lips. Good. I'm gonna listen to your back now. Okay. I'm gonna take your hair. I'm so sorry. Let's have you breathe in. Perfect. Breathe. And a deep breath. Very good. And I'm gonna take a listen to your heart. Okay. Okay. We're gonna do this twice. Just breathe normally for now. And you can move your hair back if you'd like to. Thank you. You see, there were no adventitious sounds when I listened to your lungs. They were clear and regular breaths that you were taking, and now listening to your heart. There's no irregularity. I hear SOS too. I'm not concerned for um, like an arrhythmia. Okay, let's take a listen here as well. So sorry. Perfect. Now we will re-listen. Okay, and now this time I'm looking for murmurs. Okay, rubs or gallops. Everything sounds great so far. No murmurs, no weird heart sounds, no murmurs, no gallops, no rubs. Your heart sounds regular. Okay? Your normal love done, your normal S1, S2. Okay, now I am going to check your pulses. So I'm going to check your hands, like around your wrist area. Okay. Healthy. Okay, I can feel them. They're +2. They're not too strong, not too weak. It's a great one. What else can we put in here? Some normal. Okay. All right, they feel normal. Okay, and now we're gonna move on to your abdomen. So I'm gonna have you probably lay back this way. Okay. Very good. And I'm just gonna sit beside you here if that's okay.
Yes.
All right. So now I'm gonna listen to your abdomen first. Sounds good. Okay, so I am hearing your gurgles, so that means it's normal active for your bowel sounds. Perfect. And now you are going to feel me touch you, if that's okay. Okay. So we're going to percuss, okay? And the sound is timpani, Now I'm going to palpate, okay? I'm just going to go in, we're going to do this twice. This is the light palpation. So far, so good. Now we're going to wiggly, and now we're going to go in a little deeper, okay? Very good. And there's no organomegaly here. And your liver feels like it's its normal size. It's not sticking out, okay? And your abdomen was soft. It was flat. Um, it was non-distended. There was no tenderness when I pushed down. It didn't hurt.
No, not
Okay,
at all.
perfect. Okay, and now we're gonna check your musculoskeletal system. So we do want you to move around. I'm gonna have you get up. Okay, so I'm gonna have you just stick out your hands. Okay, you're gonna push me up while I push you down. Okay, perfect. And now the other way around. Very good. I'm gonna have you stick your arms out. Do this motion. Okay, so the normal range of motion, no pain.
No.
Perfect. I'm gonna have you move your shoulders. Okay, I'm gonna have you move them upward. Good. This cranial nerve 11, which is intact. Okay, and then I will have you move. Have you take a seat now. Okay. And then we're gonna have you move your leg upward against my hand. Perfect. This one too. Perfect. We're gonna have you stick your feet upwards as well, so I can check your. Good. We're gonna move forward like this, forward, and then this one as well forward. And then you're gonna leave your feet on the floor. And you're gonna move just your toes upward, okay? To check your strength. Very good. Perfect. And while you're here, I'm gonna check your pulses. Okay. +2. I'm gonna check the pedal pulses. +2. I'm gonna check. Okay. +2. Very good. Okay, and then I will have you stand up again. I'm so sorry. And then we're gonna have you just walk forward.
Okay.
And have a steady gait and have you walk back. Perfect. And then overall, as well, your skin. We're taking a look at your skin before we are checking. So far, everything looks great. There's no open wounds. Your capillary refills less than 3. Yep. And your nails look fantastic. Nice and long and healthy. Okay. And your skin is warm and dry. Okay, so you, my patient here at Gracia, my 17-year-old patient is alert and oriented to person, place, time, and situation. So for that, I do have to ask you some questions. So can you tell me your name?
My name is Gracia.
And where are we right now?
We're here at the clinic.
Perfect. And do you know what today is?
Today is May 17th.
Yes. Perfect. And what year?
We're in 2026.
Perfect. And then what are we doing?
We're here for my physical.
Okay, great. All right, so we're gonna get into the rest of the cranial nerves we have not checked.
Okay.
When I did check your eyes, we did check your pupils. We checked cranial nerve 2, 3, 4, and 6. Now we will be checking your facial cranial nerve. So I'm gonna have you smile, raise your eyebrows. Good. So this cranial nerve is intact. Your cranial nerve 8, which is your hearing, as well. We'll check with the whisper test. Okay, so I'm gonna say 2 words. You let me know what you hear. Okay.
Green apple.
Good. And now we will do over here. Okay.
Red apple.
Very good. Okay. And now we already checked your cranial nerves 10, 9, and 11, which are your shoulders. We had you stick out your tongue as well, and your tongue is midline. Okay. And then your motor functions, we did check that. Your upper and lower extremities, those were intact. Good strength, 5 out of 5. And then we will check your coordination now. So this is part of your neurological exam. Okay. So I'm gonna have you touch your nose. Okay, no, touch my finger. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Very good. Now with your other hand, okay, do the same thing. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Touch your nose. Touch my. Very good. And I did have you walk already, and your gait is steady. So now we will actually have you stand up. I'm gonna have you kind of hug yourself like this.
Okay.
And you'll close your eyes. Okay. No dizziness, no feeling like you're gonna fall.
No.
Okay, you can open your eyes, very good. And then I will also have you stand, you can relax your arms. I'll have you stand on one leg, and I'll have you, just like that. No balance issues?
No.
It's your other leg. Perfect. Okay, now you can have a seat. Now, I'm gonna go ahead and check your reflexes, okay?
Okay.
So I'm gonna check the inside of your arms over here. I'm gonna extend. And this should just jump completely. Okay, that's normal. Good. So your upper reflexes are intact. It's 2 plus. They're deep tendon reflexes, okay? And now we're gonna check your knees. Very good. Okay, your deep tendon reflexes on your lower extremities are also symmetrical and 2 plus. Okay. Now I'm gonna just touch you lightly on your arms. Okay. Does this feel the same on both sides?
Yes.
Does this feel the same on both sides?
Yes.
And does this feel the same on both sides?
Yes.
Okay. Now we're gonna go on your legs. Okay. Is that okay to touch?
Yes.
Does it feel the same on both sides?
Yes.
Same on both sides?
Yes.
And what about here?
Yes.
Perfect. Okay. Now, okay, Gracia. So overall, everything looks very healthy, very well. If there's ever a point you do not feel well, please, call us and make an appointment. As you see, you do not need a parent to be here with you since you are 17 years old. Um, we do recommend for you to continue your healthy diet, continue your regular exercise, your hydration. Um, we do want you to continue your adequate sleep. I do want you to follow up in a year to have another physical exam.
Okay.
But everything looks great.
Okay.
So, it's important to keep your stress managed. I know school can get overwhelming, but try your best. Exercise is always helpful with that. So continue that. Continue your no substance use. Abstinence is always key. There are sexually transmitted infections out there. Always use protection if you ever do become sexually active. We do have options of birth control. We also offer it if you're ever interested.
Okay.
And I'm doing a review your immunizations. So you are up to date with everything so far. I did see that you got your flu shot and your COVID booster during the flu season.
Yes.
But we do want to speak to you regarding your HPV vaccination and for meningitis as well, which is called the meningococcal.
Okay.
So the series, usually it does start at around age 11 to 12 years old, which I did see that you got. But otherwise, I think the only thing that's going to be due for you is, let's see. Oh, just your meningococcal. Oh, no, you already got that at 16 years old, so you actually don't need that one. It was already completed. So I just recommend for you to come back again this flu season for another flu shot.
Okay.
And another COVID booster if you'd like, okay?
Okay.
All right, Gracia, so you tolerated the examination well, and you verbalized understanding of care. Thank you for coming in.
Thank you.